Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is BC's COVID-19 briefing for Monday, May 18th, Victoria Day in Victoria. I want to just start by acknowledging the very difficult, terrible events yesterday in Kamloops. As we all know, the Snowbirds were part of a national tour called Operation Inspiration to really recognize and support Canadians at this difficult time. The idea was to lift our spirits, and what happened yesterday was awful for all involved. We know as a result of the crash that Captain Jennifer Casey passed away, and we send out our condolences, really the sorrow of everyone in BC, from Kamloops to everyone in BC, to her family, to her friends, and to her colleagues. And Captain Richard McDougall, who sustained serious injuries. Tragedy was felt in Kamloops, it was felt everywhere in Canada, and we wanted to both acknowledge and pass on our genuine sense of sorrow. And also to thank the healthcare team at Interior Health, the first responders, the ambulance paramedics, the BC Emergency Health Services team, the Kamloops firefighters, the Kamloops Airport Fire Rescue, the Kamloops RCMP, and of course the people of Kamloops for their response and for their support, and to Mayor Christian as well. Les snowbirds des Forces canadiennes effectuaient une mission unique, baptisée Opération Inspiration. Et comme vous le savez, une journée vraiment terrible pour toutes les personnes impliquées hier, et une perte déchirante pour la famille, les amis et les collègues du capitaine Jennifer Casey, qui est décédée de cet accident tragique, et du capitaine Richard McDougall, qui a subi des blessures graves. Cette tragédie est ressentie par tous les Canadiens, ressentie à Kamloops et dans tous les coins de ce pays, du pays. I also wanted to acknowledge that we're here and honored to be here on the territories of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. I wanted to say that tomorrow, Dr. Henry and I will be providing a briefing on COVID-19 here at 3 o'clock. On Wednesday, we'll be releasing a written statement, also at 3 o'clock, and then on Thursday again, we'll be providing an additional briefing. And with that, I'd like to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. So we are updating the cases today for 2 reporting periods, Saturday, May 16th to Sunday, yesterday, and then yesterday through midday today. On both days, we have 8 new people who have tested positive for COVID-19. So that's 8 on Saturday and 8 again in the past 24 hours, giving us 16 new cases, bringing our total in British Columbia to 2,444 people who have tested positive for COVID-19 in the province. That includes 882 people in the Vancouver Coastal Health Region, 1,195 in the Fraser Health Region, 126 people on Vancouver Island Health Region, 181 in the Interior Health Region, and 60 people in the Northern Health Region. We continue to have 19 active outbreaks in our healthcare system, including 14 in our long-term care or assisted living homes and 5 in acute care units. There are no new healthcare or community outbreaks, and we have 1 more that has been declared over in the Fraser Health Region, and that is the outbreak that was at the Dufferin Care Centre. We now have 528 people from long-term care, assisted living, or acute care who've tested positive, including 326 residents and 202 staff. We now have 335 active cases around the province, and they are continually in all areas of the province. Of those, we have 47 people who are hospitalized, and there are 12 people in critical care and ICU right now. Over the last 2 reporting periods, we've had an additional 2 people who have died from COVID-19, bringing that total to 143 people here in British Columbia. And again, both of these people were in long-term care, one in the Fraser Health Region and one in Vancouver Coastal Health. And our condolences go to their families and to the care teams and their communities. We have 1,966 people who are now fully recovered from COVID-19. I also want to take a minute to recognize the tragic events that happened in Kamloops yesterday involving a member of our Canadian Armed Forces, our Royal Canadian Air Force. And today we pause and remember, and we extend our heartfelt sympathies to the family and friends and co-workers of Captain Jennifer Casey. And of course, the Canadian snowbirds, and we know that they bring Canadians together, and this is a loss that will be felt by all of us. And we thank the snowbirds and the Royal Canadian Air Force and all of the Canadian Armed Forces for the work that they do to support us across the country. And we stand beside you with our hands on our hearts in sorrow and in strength. And I would like to as well give my condolences to the family of Captain Richard McDougall and hope that he makes a full and speedy recovery. I think perhaps we might have some solace in knowing that Captain Casey maybe truly has slipped the surly bounds of earth and is dancing the skies. I'd also like to start with telling you an update about our province-wide survey about people's experiences of what has happened over the last few months, called Your Story, Our Future. We now have more than 260,000 people who have completed the survey so far. We still would like to hear from more, particularly from more seniors, for people who live outside our major urban centres, and people from different cultural backgrounds around the province. The survey is available online and by phone, and I know there has been some concerns about people when they access the BC CDC website that the certificate says it's not a secure website. I can assure you that the survey is linked directly to a secure website, and the survey results are absolutely in a secure site, and we have done a complete analysis of that to be reassured that that is the case. I've also had questions from some people asking why we're asking a number of questions on the survey, including asking about things like age and sex, education level, income, race and ethnicity. It is really important for us to understand not only who's been affected directly by COVID-19, being infected, but also the impacts, the measures we have taken across the province affect different groups. And that is why it is important for us to understand how different groups of people have been affected when questions like age, sex, ethnicity, income, education, all of these are very important so that we can ensure that if some groups are being more affected or less affected, we're able to ensure we have what they need to be able to support them. Oof. I know as well that the physical, financial, and emotional strain of what we have been through in the last few months has been difficult for everybody. And we're all now trying to understand what this means when we're going to our phase 2 starting tomorrow. For many, the transition brings anticipation, but it also, for many, brings further apprehension and anxiety as schools and businesses look to open once again. We are still learning the new ways of safe social interactions and doing things that we've never had to do before, and that in itself can create anxiety and concern. I know that even me trying it out yesterday had some challenges. I had a small number of friends over and we sat outside at an appropriate distance from each other, but it was a bit awkward and strange and a little bit anxiety provoking, not having socialized for several months. And I know the stress of this can be much more challenging for some people, and some people it can have a harmful impact. I want to say again, and we've talked about this before, if you are a victim of family or partner violence, support is available to you 24 hours a day, 7 days a week through Victim Link BC, 1-800-563-0808. And for youth who may be having challenges with the emotional struggles related to COVID-19, related to the interruptions in your schooling and the other things that are going on, the Kids Helpline is available by phone, by text, and online. And I would encourage you to call it. It's 1-800-668-6868, or you can text 686868, or thekidshelpphone.ca. And for all the rest of us, we need to continue to show that patience and compassion that we have had, both for ourselves and for those around us as we entered this new phase. We need to continue to think about consideration and generosity and respect for others. That is what will get us through. With the easing of restrictions and the added social interaction, the potential for a flare-up in new cases does go up, and we have seen that in places around the world. And us in public health, we will be watching very carefully, and we will ensure that we have the testing, the contact tracing, and the ability to manage any new cases that we see. But we all have to move carefully and stay alert. Every day we can and must do our part to continue to hold the line on COVID-19. So pause and think about how you are going to keep yourself and those around you safe. If you are using transit or going into a smaller store where keeping a safe physical distance might be more challenging, those are the times where we can consider wearing a cloth face mask to protect others. Simple things can make a big difference. I have to say, though, only you know your own risk for your family or for your business and the precautions that you need to take. If you do have somebody in your family who's going through cancer treatments, if you have somebody who is ill, if you have elderly members of your family who are anxious and concerned, you may need to take more precautions and continue to do the measures that you have been doing. We may not always get it 100% right all the time as we're moving forward, but that's okay. We're not alone. We are all in this together, and we will work through this together in the next few weeks. I will say one thing. I know it has been particularly difficult for people who have had loved ones in long-term care or in acute care in the past few weeks and months. And I received many, many emails and letters about people's individual situations and requesting that I intervene. As much as I empathize absolutely with every individual case, I simply cannot interfere in decisions made by an individual care team, and nor would it be appropriate for me to. But I do want you to know that we hear you, we know this is a challenging time for everybody, and that there is a place for you to connect, and that's with the Patient Care Quality Council offices in each of the health authorities, and they are there to support you for your individual needs through this. Our well-being and our future is still in our hands, and we must continue to watch them, and we must continue to be kind and to be calm and to be safe.
Thank you very much, Dr. Henry. And I wanted to start by echoing the condolences of Dr. Henry to the two people who passed away from COVID-19 this weekend, from Saturday to Sunday this weekend, one in Vancouver Coastal Health and one in Fraser Health. As Dr. Henry just said, these are very, very challenging times. For example, in long-term care, difficult for families and difficult for everyone, difficult times to be going through this. And obviously, just a terrible time to have someone you love pass away. So we wanted to, again, support people in their sorrow, in their grief, and to give our condolences to the family, to the friends, and the caregivers of those who passed away. As noted, there are now 47 people hospitalized with COVID-19 in BC. That's 24 in Fraser Health, 1 in Interior Health, 1 on Vancouver Island, 2 in the Northern Health Authority, and 19 in the Vancouver Coastal Health Authority. As Dr. Henry has said, 12 of those people are currently in critical care, and obviously these numbers are down from where they were at the early part of April. The high of 149 hospitalized. We're at about just over a third of that, and the high of 72 in critical care, and we're at about 1/6 of that high as we speak. There are continue to be about 2/3 occupancy rate, 67% occupancy rate in our hospitals around BC, about 50% occupancy rate in our critical care units. In the last number of days, we've continued consistently at a new level of emergency room visits. It changes somewhat every day, but it's been between about 4,700 visits and 5,200 visits for the last week. Want to express our appreciation to the 260,000 British Columbians who so far have taken the survey and encourage more to do so. It shows the level of engagement, I think, by British Columbians with all the ways that they can get involved in defeating and helping in the COVID-19 pandemic in BC. We note that more than 3.25 million visits or self-assessments have been done with our self-assessment tool, and that we have about 208,000 people who are users of the app, the COVID-19 app that's been provided. So that shows the level of interest, support, and engagement people have. I want to continue to encourage people to use 811, where there are essentially no wait times now. If people are seeking medical questions, whether it's about COVID-19 or anything else, we get approximately 2,000. It's come back down to 2,000 calls a day on the 811 line. All of them essentially are being answered, and the wait times are well under 30 seconds now, which was obviously a significant achievement by the people involved. Just to put it in context, at the beginning of this, prior to COVID-19, there would be about 1,200 calls a day. It went up to close to 6,000 calls, and now it's at about 2,000 calls. So there is and continues to be the ability to do that. I want to thank people in BC in this long weekend that we're at, which is a significant long weekend in the year, for continuing, I think, overwhelmingly to follow the advice of Dr. Henry, to follow the advice of medical health officers, and to maintain physical distancing. A lot of discussion. There's always a long discussion in each of the long weekends. There was an Easter, and there is now about travel on a long weekend. We do have some numbers from BC Ferries, just to put it in context, that on the major routes in 2018, from Thursday to Sunday of the Victoria Day weekend, there was 163,578 passengers. This weekend, in the same period, there's 32,921. On Route 3, which is Horseshoe Bay to Langdale, 23,586. This weekend, 7,649. In the Southern Gulf Islands, 15,424. This 2 years ago, this weekend, 4,065. The other minor routes, 54,231 to 17,781. And in the north, 1,017 in 2018 to 118 this weekend from Thursday to Sunday. I think this indicates that, while obviously there is travel going on in the province, that people have been mindful of the guidance they've received. Obviously, as well, in BC Ferries, there's a reduction in the capacity on the ferries, which has reduced ridership as well. But I think it's important to acknowledge that all that's gone on. I would say, just in general, on the long weekend, it's just observation that we mostly stayed close, we stayed apart and stayed safe, and we kept our highways and ferries clear for the most part for those doing essential travel. Phase 2, as Dr. Henry has said, as you know, starts tomorrow, and through our efforts this weekend to stop the spread, we're giving our social, surgical, and economic renewal the strongest chance for a great start. But let's be clear, despite the changes we will see around us starting tomorrow, what we won't see is the most important fact of all. COVID-19 is still with us in every single health region in this province. Phase 2 is about increasing our rate of contact to about 60% of what it was before COVID-19, a doubling of the contacts we've had up to this point. What does not change, what will not change for months, is that for us to travel safely from and through the recovery phases, we must continue to carry our passport to safety with us at all times. That means the skills we've been taught to stop the spread of COVID-19 stay with us every step of the way, every moment of every day, no matter what phase we're in. Throughout this summer and well beyond, physical distance remains our constant companion. Physical distance, along with washing our hands, coughing and sneezing into our sleeves, staying home if we're sick, respecting and supporting engineering and administrative safeguards like acrylic barriers and crowd control, and using non-medical masks when appropriate, will protect us, our employees, our customers, those who care for us, and those who we love. Our ongoing discipline, with the same rigor in our practices we've demonstrated so far, ensures we stay 100% committed to stopping the spread and 100% all in our BC effort. All these skills we've learned pose challenges and limit some of the traditional ways we've interacted with one another. Sticking with them now will give us every opportunity to make this a summer that renews BC and makes us stronger together along the way. Aujourd'hui, nous faisons le point sur le nombre des nouveaux cas pour 2 périodes de référence de 24 heures chacune, soit celle du 16 à 17 mai et celle du 17 mai jusqu'à 18 mai en mi-journée. Pour la première période de référence, qui s'étend jusqu'au 17 mai, nous avons eu 8 nouveaux cas. Au cours des dernières 24 heures, 8 nouveaux cas se sont ajoutés. Cela représente 16 nouveaux cas depuis notre dernière mise à jour samedi pour un total de 2444 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 2 nouveaux décès liés au COVID-19 dans la régie de santé de Fraser et un dans la régie de santé de Fraser et un à Vancouver Coastal, pour un total de 143 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches pendant la pandémie COVID-19. Parmi l'ensemble des cas confirmés de COVID-19, 47% sont actuellement hospitalisés, dont 12 en soins intensifs. Thank you very much. Merci beaucoup. Happy to take your questions.
Thank you.